an Aboriginal Health Transition Fund project. October 26, 2010, Kahnawake. Sponsored by Ungwat Dakaridatsara, funded by Health Canada. Health and social services in Kahnawake, past to present. There is a long community history behind the development of administrative control of health and social services in Kahnawake. Here is the brief overview. Historical context: Mohawk control of Mohawk health. Contact to now. Traditionally, wellness well-being meant leading a balanced life, developing all the gifts given to a person. Health is seen holistically. Individuals made up of mental, emotional, physical, and spiritual components that intertwine with each other, society, and the rest of creation. Traditional medicine people were sought when a person was not well. Ability to organize and coordinate. Mohawks have a strong history and reputation built on ability to coordinate and organize their communities. Beginning of numerous grassroots movements. This capacity can be traced back to the building of the Haudenosaunee Confederacy, of which Mohawks are a part. Taking control. First steps, 1905-1959. In the early 1900s, few Kahnawake people ever saw a doctor. In extreme emergencies or epidemics, a doctor could be brought in by boat from Montreal. Dr. Angus Patton became Kahnawake's first native doctor. In 1905, a Madame Perrault secured a building for a hospital in Kahnawake. Lack of federal and provincial support resulted in transfer of the hospital to the Religious Order of Nursing Nuns, Daughters of Mary, by 1919. Eventually, the nursing sisters also left due to financial difficulty. In 1955, the hospital was taken over by community and operated under the name the Kettering Memorial Hospital. The Kettering Memorial Hospital Center, KMHC, is born. The cost of a visiting doctor were covered by Health Canada, and all other costs were covered by constant fundraising and volunteer staff. Community development, 1960-1975. In the early 1960s, a visiting public health nurse was responsible for school health and baby care. Eventually, the public health nurse was changed to a community health nursing program and located under the management of the KMHC. In 1969, a partnership with McGill Medical Consultants developed a proposal for a federally funded community health center located in the community. The clinic opened in 1970 with the community health nursing and social services programs operating from the same building. In the early 1970s, a community board of directors of the hospital and health center was established. Community development, 1960-1975, continued. By the mid-1970s, the community health nursing program had strong immunization and school programs, had developed a maternal child health program, and solidified partnerships with other community organizations and leaders to address key health issues and needs. Kahnawake secured control of managing and administering its social services through a funding arrangement with the Department of Indian Affairs and a partnership with Ville Marie Social Services. Infrastructure, accountability, and integrated approaches, 1980-1998. In the early 1980s, the Mohawk Council of Kahnawake, MCK, made the unprecedented step of delegating authority for signing agreements with the federal and provincial governments to its health and social service community organizations and boards. In 1981, the Community Health Representative CHR program was established in Kahnawake. In 1982, the Kahnawake Alcohol and Drug Abuse Prevention Program was established. In 1983, a regional film library was established. By 1985, The three programs were consolidated with social services, and Kahnawake Sagotia Degenhas Community Services, KSCS, is born. Infrastructure, Accountability, and Integrated Approaches, 1980-1998, continued. In the mid-1980s, the KMHC Board of Directors and the MCK successfully negotiated with federal and provincial governments for funding to construct a new hospital and to enhance existing health services. This agreement concerning the building and operation of a hospital center in the Kahnawake territory was signed in 1984. This agreement with the Quebec government is unprecedented as a nation-to-nation agreement recognizing Mohawk control of health and assigning special status to the KMHC. In 1986, the Health Consultation Committee, HCC, was created to determine how to utilize new health and social services funding and where joint training activities could benefit Kahnawake. At the time, HCC representation was made up of the Onodogo Treatment Center, Kahnawake Sagotia Degenhas Community Services, three main programs, Kahnawake Social Assistance, Cattery Memorial Hospital Center. Infrastructure, Accountability, and Integrated Approaches, 1980 to 1998, continued. By 1987, KFCS had developed its own constitution and bylaws for its board of directors. These were adopted by the KMHC and the Kahnawake Fire Brigade with adaptations to meet their needs for governance. In the early 1990s, prevention programs under the KMHC and KSCS mobilized the community around important health issues. In 1993, the Health Consultation Committee membership increased to include representation from Kahnawake Ambulance Service and Mohawk Council of Kahnawake. In 1995, the Community Services Complex building is built, home of KSCS. By 1996, after much negotiation, KSCS enters into an integrated services agreement with Health Canada. This agreement prepared the way for health transfer. Health transfer, 1999 to present. Kahnawake's first community health plan was completed in 1998. It would be updated every 5 years. In 1999, the Mohawks of Kahnawake entered into a health transfer agreement with Health Canada. This agreement allowed for much greater flexibility in supporting a wide range of formal programs offered primarily through KSCS and KMHC. Kahnawake has been operating successfully under health transfer for the past 12 years. Negotiations will begin for a renewal of the agreements for 2012. Health and Social Services present day. Health and social services within Kahnawake is currently comprised of several public, non-profit community organizations and private practitioners. These services as a whole are and have been under Mohawk control as we have been able to assert responsibility for them and negotiating funding arrangements to support their administration. We are constantly in a state of exploration on issues of jurisdiction, public policy, and fiduciary responsibility with different governments in order to provide the best possible services to the community. Ungwa da Garidatsara, a Mohawk word meaning for all the people to be concerned in the area of good health, is the responsible body that oversees Ganyankahaga Mohawk control of Ganyankahaga health. Serves as the one health commission within Kahnawake, responsible for planning, maintaining, and improving health and social services for the community. Historical background of Ungwa da Garidatsara. Originally began in 1983 as the Health Consultation Committee, HCC. In 1996, KSCS developed a health policy unit through the Integrated Service Agreement to give technical support to the HCC. Evolved into Ungwa da Garidatsara with a renewed and expanded mandate through MCK Resolution, MCR number 25/1997-98, acknowledging it as the governing body responsible for the global health and social services for Kahnawake. In 1999, a revised Moha Council resolution was passed to adopt Ungwa Karidatsara's constitution and bylaws, and to amend from being a governing board to the body responsible for overseeing Kanien'kehá:ka Mohawk control of Kanien'kehá:ka health. Kahnawake recognized the need to formalize community partnerships. The goals of Ungwa Karidatsara at a community-wide level: to assume responsibility and control to determine health and social priorities, to resource allocations for all health and social services, to promote and advocate for optimum health and social services for all Kahnawake Ronu, to plan and manage global health and social services. Ungwa Karidatsara's members. Ungwa Karidatsara currently has a number of seats represented by the following: community elders, Mohawk Council of Kahnawake, chiefs representing the Health and Social Services portfolio, Katter Memorial Hospital Center, Kahnawake Sagot Community Services, and Kahnawake Fire Brigade and Ambulance Service. Ungwa Karidatsara Operations. Table meets every month. Executive Committee will meet to address pressing issues. Responsible for the Community Health Plan and Emergency Plan in the area of health and social services. Conducts needs assessments when funding permits to ensure resources are directed to the areas of most need and priority. Uses subcommittees to assist in the work we carry out. Mohawk Council of Kahnawake. The Mohawk Council of Kahnawake is the elected governing body that has mandated a majority of the health and social services that exist in the community today. The Mohawk Council of Kahnawake is the elected government for the territory, with a political mandate to represent the community's interests. One Grand Chief and 12 Council Chiefs are elected for 3-year terms to serve the community based on portfolio assignments. The Mohawk Council of Kahnawake operations provide services to the community, including land allotments, housing loans, social assistance, and membership services. Each community board of directors receives their mandate from chief and council to operate. The MCK employs approximately 320 individuals, including full-time and seasonal workers. Katter Memorial Hospital Center. KMHC governed by a 7-member board mandated by the MCK. Mission: to strengthen the health and well-being of Ungweshun'a by providing, in partnership with others, quality and holistic services that respond to the needs of the community. Services: currently 33 long-term and 10 short-term care beds, soon to be expanded to 73 beds. Home care nursing, family medicine, nutrition, counseling, education, rehabilitation services, day center, dental, ophthalmology, and a community health unit, which provides newborn home visiting, well-baby prenatal clinics, school health, adult prevention programs, immunization, etc. Services provided by a staff of 194, not including physicians, consultants, and other service providers. Funded through MSSQ and FNIHB. Celebrated 100 years of service in 2005. Katter Memorial Hospital Center has been accredited with commendation June 2012 to June 2016 by Accreditation Canada. Kahnawake Sagot Community Services. KSCS, governed by an 11-member board mandated by MCK resolution. The KSCS Constitution and bylaws has served as the template for a majority of community organizations within Kahnawake and other First Nation institutions. Began as social services in 1970s, then taken over from the province. Integrated environmental health and addiction programs in the 1980s. Expanded services to include home and community care, assisted living services, healing lodge, parenting, training, and consulting. Funded through Health Canada and Department of Indian Affairs. Has been a driving force in using participatory action research to develop its services and programs, and to mobilize the community for major change efforts. Advocated with community partners and leaders to develop community criteria for services and programs more relevant to community needs. Services are provided by a staff of 182 via 7 service facilities in the community. Our mission is to encourage a healthy lifestyle. Kahnawake Fire Brigade and Ambulance Service was formed in 1961 as a volunteer fire brigade. Established Constitution bylaws in 1966. Mid-1970s, a no-charge ambulance service. 1986, a Quebec ambulance permit was obtained which allowed third-party invoicing. All 42 members are still volunteers. A minimum of 1 fire officer, 2 ambulance technicians, and 5 firefighters are on duty 24 hours a day. Has its own medical director who was instrumental in developing the provincial pre-hospital use of defibrillators and medication. All personnel are fully certified as paramedics or first responders. Firefighters are certified to National Fire Protection Association Firefighter Level 1. Training is conducted by members who are certified instructors according to industry standards. 2003, the brigade took over medical transportation services funded by Health Canada. Independent health and social service practitioners. Kahnawake has traditional Mohawk healers who offer services to community members. There is a pharmacy within the community. We have several private practitioners, dentists, GP, operating in the community that have been licensed through the KHCPL. These practitioners are not members of Ongwa Garidatsara, but have a role in health and social services for the community. Community Health Plan. As part of community health planning, the community has conducted 2 major needs assessments. Kahnawake's top health priority areas as identified by the community are substance abuse addictions, mental health issues, learning developmental disabilities, cardiovascular disease, hypertension, cancer, diabetes, obesity. Ongwa Garidatsara has placed the 7 priority areas into the following 4 categories to review, assess gaps, create links, and develop goals that align with community efforts. Mental wellness and addictions, early childhood wellness, chronic disease, cancer, holistic health. Our Kanien'kehá:ka traditions and values have always influenced a holistic approach to healthcare and social services delivery. We look to the medicine wheel teachings to guide us as we move into the future and continually seek ways to improve the health of our community.